you, Madam Speaker. I rise today on behalf of the official opposition to offer my thoughts and prayers to the Prime Minister, his wife, all parliamentarians, and indeed all Canadians who are experiencing or know someone affected by COVID-19. I would also like to thank all public health officials and frontline healthcare workers who are working around the clock to keep Canadians healthy and safe. These are extraordinary times. With the World Health Organization declaring COVID-19 a global pandemic, it is incumbent on everyone to exercise the highest degree of caution. My colleagues and I, in direct collaboration with our friends across the aisle, have come to an arrangement to suspend Parliament while ensuring the government continues to have the authority and capability to provide our country with necessary financial supports. There continue to remain significant questions about the Government of Canada's management of this pandemic, and while we understand that COVID-19 does not respect borders, the government can consider measures to further contain the virus from spreading, such as more vigorous screening upon entry, mandatory quarantine for those who do enter from high-risk countries, or potentially stopping incoming and outgoing flights from high-risk areas. The government relying on Canadians to have enough supplies to weather the pandemic is simply not enough. Canadians need to be reassured that the government is prepared to assist and support those affected by the coronavirus. We also need to see a comprehensive plan to protect the health and safety of all Canadians.
In Canada yet, but yesterday in the last 24 hours we have 2 cases under the age of 18, one quite young. That substantiated my concerns that children can have it and be present in that, especially if they're contact of cases, as these cases were. And while I don't believe there's much illness, it does give the potential of bringing back infection and introducing it into various settings, including schools and daycares.
Sophie Gregoire Trudeau had been traveling in the United Kingdom. She was delivering some speaking engagements there. And when she returned, a few days after she returned, she started to develop mild flu-like symptoms. That was Wednesday night. Thursday morning, she got tested for COVID-19, and late this evening, she is positive. She has COVID-19. So as a result, she is now in quarantine for 14 days. She says she's feeling okay, a little bit uncomfortable, but nonetheless doing all right. But 14 days in quarantine. Most importantly, your husband, the Prime Minister of Canada, Justin Trudeau, is now in quarantine for 14 days. He'll have to conduct all of the nation's business from his home office using teleconference and video conference. And the first order of business for him is on Friday, when he expects to have a conference call with the country's premiers. Remember, all the premiers were supposed to be at a First Ministers Conference here in Ottawa this week. But that, of course, was postponed because the Prime Minister went into self-isolation earlier today. So the premiers, will talk about what can the federal government do to support the provinces as they respond to COVID-19. Provinces need money, they need support. That is something they'll talk about tomorrow. In the meantime, the Prime Minister earlier this evening from his home office talking to President Trump, Prime Minister Boris Johnson from the UK to talk about coordinating actions to fight COVID-19. David Akin, Global News, Ottawa.